afraid to fly? Do needles make you nervous? Do you avoid dental appointments, elevators, or contact with spiders because you're scared? If so, you may have a phobia. Phobias are intense fears about specific places, situations, or things. Phobias can make it hard for you to go places that you would like to go, make it hard to be effective at work, and put a strain on relationships. This is because people will do whatever they can to avoid uncomfortable and often terrifying feelings associated with their phobias. If you have a phobia, you're not alone. Did you know that there are over 50 million people in the U.S. that suffer and are living with a phobia? There are also 530 known phobias. Hi, my name's Amanda Moore, and I'm here today to educate you on phobias. We'll talk about what a phobia is, what different types of phobias there are, and if in fact phobias are curable. Some would ask, what is a phobia? Well, according to Degener and Gaukler from the Department of Nervous and Mental Disease at Northwestern University School of Medicine, a phobia occurs as a result of a misinterpretation of various unpleasant or distressing sensations or experiences. Neuroscience researchers have found that phobias are often linked to the amygdala, which is a small almond-shaped mass of gray matter inside each cerebral hemisphere, involved with the experiencing emotions, which lies beneath the pituitary gland. The amygdala can trigger the release of flight or fight hormones, which puts the body and mind in a highly alert and stressed state. Being that the body is in such a high and alert, stressed state, it remembers exactly what makes it feel this way. It is unusual for a phobia to start after the age of 30. Most phobias begin during early childhood, teenage years, or early adulthood. Phobias can be caused by a stressful situation or experience or a frightening event. Phobias can also be passed down. For example, if a child becomes aware of a parent's phobia, they too may take on that phobia. So you want to know what increases the risk of having specific phobias? Well, having a bad experience with a certain object or place and time, or seeing someone get hurt. Having a close family member with a phobia or another anxiety problem. Having mental problems such as separation anxiety disorder or generalization anxiety disorder during childhood. And also having parents who show too much fear and worry about certain things. These are all things that can increase risks of having specific phobias. The National Institute of Mental Health estimated in 2011 that between 8.7% and 18.1% of Americans of all ages suffer from phobias. When a person does in fact come in contact with a phobia, there are many symptoms that can arise, some which include the sensation of uncontrollable anxiety, the unable to proper functionally, sweating, abnormal breathing, accelerated heartbeat, trembling, and chest tightness. Children are also known to cry and become very clingy and attempt to hide from their phobias, and they are also known to throw tantrums. There are many different types of phobias, so many that there isn't a letter in the alphabet that doesn't have a phobia listed underneath it. Many people know the common phobias, some which include claustrophobia, the fear of feeling trapped, homophobia, which is the fear of same-sex relationships. Social phobia, which is known as the fear of social situations. The thing that many people don't know is that people suffer from different types of phobias, some which include pedophobia, the fear of children, synthophobia, the fear of dogs, xanthophobia, the fear of jealousy, and monophobia, the fear of being alone. To go over the different types of phobias, there are the common phobias, such as claustrophobia, homophobia, and social phobias. The different types of phobias that many people aren't aware of are xanthophobia, cynophobia, and monophobia. So many would ask, how do you cure phobia? If the phobia does not cause severe problems, many patients find that by simply avoiding the source of their fear is enough to stay in control. Some phobias are not possible to avoid, as may be the case with avophobia, the fear of flying. In such cases, professional help should be sought out. Phobias can be cured with proper treatments. Treatments are different, being that no two persons' phobias are alike. The doctor, psychiatrist may recommend behavioral therapy, medicines, or a combination of both. Therapy is aimed at reducing the symptoms of fear and anxiety, and to help patients manage their reactions to the source of their fear. If you're one in the 50 million people in the US who have a phobia, you might want to know how you can help yourself. Well, there are a few things that you could do. One is to keep a diary on how you feel when you face your fear. 2 is to learn more about your specific phobia. You won't know how to help yourself if you don't know everything about it. And 3 is to practice being around that fear while you're home. You're in a safe environment, so you know that if you want to get away, you know an escape route. It's the best thing to help you face your fear. So one would ask, when do you know to seek further help? Well, if your phobias are interfering with your ability to lead a full and normal life, and you don't make any progress in challenging them yourself. If you're experiencing a lot of anxiety or distress, and you seem to be feeling like this often. If you're avoiding situations that really do matter. And if you're suffering from overwhelming, blemishing, trembling, sweating, and in any social situation, you feel a lack of social skills. To review, a phobia occurs as a result of a misinterpretation of various unpleasant or distressing sensations or experiences. There are many different types of phobias, and the cure to them are different for every single person. So, the 50 million people in the US have to deal with these phobias every single day, and sometimes there's nothing they can do but avoid them. Now that I've told you what a phobia is, you know the different types of phobias, which are claustrophobia, homophobia, social phobia, zeltophobia, synthephobia, and monophobia. But these are not the only phobias there are. As I said, there are many different various types of phobias. And you also know what some of the cures may be, which could be therapy or medications. Thank you for listening. I'm Amanda Morin, and I hope you learned everything you can about phobias.